Today let's learn about chloramphenicol. I'll tell you whatever it is important in exams and you'll top the exam. You'll get all 5 points, 5 marks. Okay, chloramphenicol. Chloramphenicol is a broad spectrum antibiotic, but it is not in use nowadays because it causes very serious side effect, that is bone marrow suppression. Now let's learn about the mechanism of action. As you know, this is the mRNA. This is the ribosome, of which this is the 50 subunit and this is the 30 subunit. So codon will be present. So we have two sites. This is A site and one more is P site. So A site is the acceptor site where the incoming tRNA comes and binds. Okay. Now this is P site where already tRNAs has bind together and form a peptide here. So this is the first step. A new tRNA comes and binds to the acceptor site according to the codon present. So next step is peptide formation. So how it happens? All these three shifts here to form a peptide. So all these three has shifted. So this is the already existing one, and all the three has shifted. This happens by with the help of enzyme peptidyl transferase. Now what happens? Translocation. The whole of this moves this side. So since this whole of this moves this side, but this mRNA is going to stay in place. But this whole ribosome is going to move. So when this moves, this assumes. So this see now let's wait. I'll tell you. So this whole thing is here, but now this whole thing is moving. How does it move? It moves like this. So I'll again one is so this becomes the P side now and this becomes the A side now. So this becomes free. So a new tRNA can come and bind because that site is free. Okay guys. Now let's start. So now what happens? This chloramphenicol binds to the 50 subunit. This chloramphenicol comes and binds to the 50 subunit and it inhibits this joining of amino acid step. So this is the mechanism of action of chloramphenicol. Now let's learn about the pharmacokinetics. If we see, it is oral route. It has rapid absorption, but it can be also given as also IV and topical. Chloramphenicol palmitate, that is in pediatric age group, it is very bitter, so it is given as a suspension of chloramphenicol palmitate. It is activated by pancreatic lipase. It can cross blood-brain barrier, placental barrier. Metabolism. How does it metabolize? Metabolism is by glucuronide conjugation. Excretion is by urine. So now let's go for its uses. Only 5 uses. In none of this, it is used as the drug of choice. Okay. None of this, it is the drug of choice, but it can be used as but it is used as an alternative. Why is it not a drug of choice? Because it causes a serious side effect of bone marrow suppression. So I'll tell you how to remember. Okay, 5 things I said. So remember, first is A. Alphabet you start. A, B. So A for uh, anaerobic infection. So B is the second letter. So you have two uses. One is bacterial meningitis. Other is brucellosis. Okay. Now we have topical. I said this is oral route, also IV topical. This topical means you're going to give us drops. So topical sells some drops is there. Where you use drops, eyes and ears probably. So eye and ear infection. So topical you use eye and ear infection and you take this T. T for typhoid. So 5 uses are over. What are those? First AB you have to take. A for anaerobic infection, B for bacterial meningitis and brucellosis. Now you go for topical. Topical if you take topical ear and eye drops and others is typhoid. None of this, it is a drug of choice. Typhoid, the drug of choice is azithromycin and ceftriaxone, but alternatives you remember as 3C and 1F, because if fluoroquinolones is asked, you can write one of the uses as typhoid. So you learn here itself what are the drugs that can be used as alternative, that is 3C and 1F. F is fluoroquinolones. Fluoroquinolones. So 3C, one is chloramphenicol, another is cotrimoxazole, one is cefotaxime. So bacterial meningitis, the drug of choice is third generation cephalosporin, but alternatively you can use chloramphenicol and ampicillin. Next we go for anaerobic infections. It is most effective. It can be used along with metronidazole also. In rickettsial infection. So rickettsial T. T for tetracycline. Drug of choice is tetracycline, but when tetracycline is contraindicated, it is contraindicated in pregnancy, childhood. So in those times you use chloramphenicol. Topical is ear and eye infection you use. In brucellosis also drug of choice is tetracycline. Whenever tetracycline is contraindicated, you are prone to use chloramphenicol. So now let's start with the adverse effects. So if you see, only main three things we have. Okay, one is GI. So whenever you write GI, you know that is nausea, vomiting, abdominal pain, diarrhea, whatever, so on you can write. Next, you know the main is bone marrow suppression that I have said you earlier. So this is dose dependent and non-dose dependent. Dose dependent is when you increase the dose, bone marrow suppression increases. So this can be reversible, right? So if you stop it, so it likely decreases. But non-dose dependent, if you see non-dose dependent, it is irreversible. Okay, it is very fatal. Illness, it causes hypersensitivity reaction. Three main things is over. The last thing is gray baby syndrome. It causes gray baby syndrome is neonates. Why? Because in neonates there is an enzyme. This enzyme is deficient. Glucuronil transferase. So since this enzyme is deficient, it cannot be metabolized and it cannot be excreted. Poor renal excretion. So since this cannot be excreted and can also not be metabolized, it accumulates in body and it gives an appearance of skin to ash gray color. So this is known as gray baby syndrome. So in this syndrome, we also have symptoms of the baby will refuse to suck. There might be cyanosis, refuse to suck. There will be cyanosis, and there will be irritability. There will be circulatory collapse. Usually, the baby dies of circulatory collapse. Okay, so now we have completed chloramphenicol in one sheet and good to go. If you write this answer short, you will be able to get all those 5 points. Thank you, guys.